Hi everyone, my name is Winifred Maduko and I am a third year PhD student at the University of St Andrews in Scotland. We've heard a lot about laboratory work and I'm about to take you to the community where there are lots of interesting things when it comes to antimicrobial resistance. So today I'll be talking to you about an aspect of my research which is community-driven evaluation of antimicrobial resistance communication in Nigeria. In a very much simpler term, a lot of us as researchers, we do literature review, we do scoping review, we do case study analysis. So here, for this research, we flipped the page. We worked with community members to review communication materials on antimicrobial resistance to see if it's effective and if it's even motivating them to change their behavior, especially in countries where antibiotics are easily accessed over the counter. So imagine that you're living in one of these low-income countries or developing countries and you are sick, you go to the pharmacy or a chemist, you buy antibiotics and just immediately you bought it. You see a poster that is obviously warning you about antimicrobial resistance. However, you don't understand the words. You don't even recognize the images that were used and it doesn't feel important or relevant to you. Do you think that this message will change your behavior? While you think about the response to this question, I will talk to you about my research. So from the presentations we've had today, we've already recognized that antimicrobial resistance is a global health challenge and there will be more deaths as time goes on if nothing is done. It also highlights the importance of behavior change when it comes to addressing antimicrobial resistance, most especially in countries that antibiotics are easily accessed over the counter and also countries that have very poor water, sanitation and hygiene infrastructure, which terribly contribute to antimicrobial resistance. So this draws us to the importance of community-driven public health strategies when it comes to addressing the issue. Yes, so my research question, we tried to examine how community members perceive existing antimicrobial resistance communication materials, how effective they are, if they are related to their culture, and if they are also accessible to them. So the basic questions we asked were, how do community members perceive AMR communication materials? Are they clear? Are they culturally relevant and accessible? And can it help in improving their behavior when it comes to encouraging them to use antibiotics effectively? The method we used is quite a very simple method, I must say, but it's simple on the text, but it's not simple in terms of implementation. So we used a participatory visual review approach. This is a participatory type of research process where we used workshop. We gathered community members during the workshop, 30 of them in Enugu, Nigeria. We also tried to make sure that the participants were all inclusive in the sense that we've noticed a gap in AMR research where there are very limited number of persons living with disability being included in interventions that address antimicrobial resistance. And most especially, this particular group of people may be using antibiotics more due to their condition. So we tried to involve different aspects of participants to make sure that communication materials are not just influencing maybe a particular group of people, but making sure that it's an inclusive communication approach. So they reviewed 23 AMR communication materials which were retrieved locally, nationally, and internationally, and the data were analyzed thematically. On the screen right now are some of the posters that the community members reviewed. Some of these posters were gotten from the Nigerian Center for Disease Control. So I would like for you to pay attention to this poster because some of the results that I will be presenting next were gotten from one of the posters here, which I won't point to, but I will let you do the math. So based on the key findings, we grouped the findings into 4 major issues. First is the use of medical jargon and complex language. I was having a conversation with someone over there and he was asking me, how do you then think about science communication when it comes to antimicrobial resistance? And we were having a conversation like this on why it's important that when you're doing the lab work, think about community members who are most often affected by some of these issues. So a lot of the community members identify the use of medical jargon and complex language when it comes to creating communication materials for antimicrobial resistance. Another point that was highlighted is the lack of local languages and cultural references. A lot of them felt, just like the question I asked earlier when the presentation started, a lot of them felt this doesn't relate to us. Maybe it's a problem for people somewhere else, not based in Nigeria, people who are probably doing the more problem, but they felt that it doesn't relate to them, it's not relevant to their culture. And again, some of the images were disconnected from their local realities because they felt, oh, the person doesn't look like me, that means it's also not our problem. And the final point is that the messages that did inform them, there were no clear guide action for them on what to do. So you've told them antimicrobial resistance is a very dangerous thing that can affect your health. Okay, now they know, so what? So they felt there were no clear guidance for them on what to do next. And on the right side of the slide, which should be your left, these are some of the quotes from some of the participants. So the guy is saying, if I myself cannot understand these words and actually what they mean, how do they expect someone in my village to know what to do? So this is calling on us as researchers, and not just researchers as well. When we're talking about science communication, people in the community, they have different levels of education. So it's very important to use clear and simple terms. So the second person, who is participant 17, said, how can this person even be sick if they look so well dressed, strong with makeup, accessories, and look healthy? So this also highlights the importance of images, graphics, when it comes to communication. And I mentioned earlier about the poster. By now, you should be able to identify the poster that this participant is talking about. So it's very important as well in science communication to consider all of this. So based on the participants' recommendation, they are saying simpler language, use of local languages and idioms, visuals reflecting local context, storytelling, metaphors. And when it comes to AMR communication as well, it should be participatory, not just top-down, but everyone working together, the experts and community members. It should be culturally grounded, accessible, and action-oriented. Community members should not only receive messages, they should also help in creating them. Thank you so much, and many thanks to our funders as well. These are a list of references. If there are any questions, please ask. Thanks.